Hello and welcome to today's Connect and Learn webinar, working with people who use family violence during COVID-19. My name is Sheridan and I'll be facilitating the webinar today. But before we begin, I'd like to acknowledge that we are recording the webinar on Aboriginal land, the land of the Wurundjeri people of the Kulin Nation. I'd like to pay my respect to Aboriginal people who may be watching today and pay respect to elders, both past, present and also emerging. So before we get into the content, I do just want to make sure that everybody knows how to use the features on this webinar. There's a few here. We don't have the chat enabled today, so just in case you are looking for chat, we don't have that enabled with us today. But what we've got is the Ask a Question. So you'll see up the top right-hand corner of the screen, there's a little blue and white hand symbol there. If you would like to ask a question, I've got a iPad in front of me and those will come directly through to me and I'll be filtering those through and presenting those questions to our guest speaker today. So you can go ahead and do that at any time during this presentation. So we invite you to ask questions. If you've also got comments, please pop those into the Ask a Question section there as well. The next one that you'll see on the screen there is an icon that's for the downloads, the little blue and white icon with the arrow pointing down. We've got a few downloadable PDFs there today that the speaker's given us, and they are for you to download for you to have a look at during the presentation, but to take away with you. They'll probably be referenced throughout the day, throughout the presentation as well. And then finally, you've got a yellow icon, which is our survey feedback. We really want to have your feedback so that we know how to curate webinars in the future and what kind of topics or what kind of speakers or specific speakers you'd like to see on these webinars. So please, especially if you can't stay until the end and do the exit survey for us, then if you have to leave early, please just click on that icon and you'll get a really short survey there, and that will be able to help us to get feedback from you. There might be topics within today's webinar that you think you might have wanted more information on. So make sure to be specific and give us that kind of direction as well. Before we kind of move on, I did want to just frame up this webinar today. Obviously, it's a really big topic, and it's not a topic that we're really going to be able to provide training in a 1-hour webinar, and I think that's probably is already understood. But what we are going to do today is going to give you some best practice tips and also some ways to reflect on the practice that you're already doing. So there will be an activity today. Claudia's going to present an activity that you can take back to your teams. What we want to say is that, we want you to reflect on some of the information we're giving you today and really look at the kinds of ways that you're already doing this work, wherever it is that you work. There's a little over 400 people registered for this webinar today. So, and when I had a look down the email addresses, I can see, even though we're a state, these are funded by the Department of Health and Human Services in Victoria, I can see we've got people from all over the country who are actually tuning in today. So please do take this information back to wherever it is your place of practice and really work with the people in your teams to look at where you could implement some of these ideas and some of these practices in the work that you are currently doing. And also, just to remember to also, take care of yourself as well. Some of these topics can, even though we won't be describing violence or describing abuse, sometimes just the idea of power and control can leave people feeling a little bit emotional, and it wouldn't be uncommon for you to feel something at the end of this webinar or even during. So we really encourage you to also consider that and take care of yourself today. Just to also frame up some of the languaging you might hear today, you're going to be hearing the words perpetrator and victim survivor, but perpetrator and people who use violence interchangeably. So there'll be some different wording, and some of the language will also be gendered as well. So that is, it's the language that's used in our legislation. So throughout today's presentation, you'll hear the same language that's used in the legislation as well. So I think that's all I wanted to say. I think I'd like to introduce our presenter. We're so grateful that Claudia Fletcher has made time to come and give this presentation today. Claudia serves as the statewide coordinator for the Specialist Family Violence Advisor Capacity Building Project in Mental Health and Alcohol and Other Drugs, to which she brings the perpetrator practice lens. And previously, Claudia practiced as a men's family violence counsellor and team leader at the Men's Referral Service. And her education and practice background are in clinical mental health counselling. So I'd like to welcome Claudia. Thank you so much for being here and taking this time. Really appreciate it. We know everyone's very, very busy right now, so thank you very much.
Yeah, thank you for having me, Sheridan. It's really nice to be able to come and, speak to your sector and to be able to unpack. And obviously, we're very limited in what we can do in an hour, but hopefully provide some things that AOD clinicians can take away and think about in terms of their practice and, get the conversation really going on this if it's not already. So I will be talking about working with people, and I'll also use the word men as well in gendered language who use family violence, particularly during COVID-19. So I'm going to weave that, some themes seen during COVID into this presentation. And to add on to the acknowledgement of country, I also want to acknowledge the courage and resilience of adults and children who are victim survivors of family violence and those who have not survived. Increasing their safety is the purpose of everything we do. So here are some of our aims today. We really want to be able to flesh out some answers to these questions, but they will not be all the answers to these questions, of course. So, how do we recognize when a client who seeks support from AOD services may be using family violence? What does safe practice look like? And how can we maintain engagement with clients who use family violence in the AOD sector and setting? So I'm from No to Violence. We are the peak body for organizations and individuals working with men who use family violence. We do workforce development, policy advice, practice development, and training. We also have the Men's Referral Service, which is our service arm. I sit within the practice development team, and as Sheridan noted, I'm the statewide coordinator of the Specialist Family Violence Advisor Capacity Building Program in Mental Health and AOD. So that's a project responding to recommendations 98 and 99 of the Royal Commission into Family Violence. As you may well know, there are AOD Specialist Family Violence Advisors who sit across the state of Victoria. So the Men's Referral Service is now a national service in light of COVID-19. We have a team of counselors who work with men who are using controlling and violent behaviors toward family members. We're also available to speak to women or other concerned family or friends who are seeking information about men's use of family violence. And we're also here to support professionals wishing to, support a client who's using or experiencing family violence. So Sheridan is going to note a little bit here on the Family Violence Protection Act of 2008.
So we just wanted to make sure that everybody kind of has a foundational understanding of what family violence is. And as I said earlier, I have noticed how many people are with us today who aren't in Victoria. So I did just want to make this note, just be clear that really everybody should be looking at their state legislation and really getting a foundational understanding of what family violence is to really understand this issue, to be able to kind of move into the identifying stage, to be able to identify somebody who is a user of family violence. You have to understand what the legislation says and what it really means. In this state, in Victoria, we have what's called the Family Violence Protection Act of 2008. And so I've got that here, it should have been on the slide, but technology. So in our legislation, it says behaviour by a person towards a family member that is physically or sexually abusive, or is emotionally or psychologically abusive, or is economically abusive, is threatening, is coercive, and in any other ways controls or dominates the family member and causes the family member to feel fear for the safety or well-being of that family member. And in Section B, which was a new addition in 2008, it is behaviour by a person that causes a child to hear or witness or otherwise be exposed to the effects of behaviour referred to in all of the above. So we're really just wanting to be clear, like what we are talking specifically about family violence. Look at your legislation, make sure you understand what it means, but you can hear within this legislation in Victoria, and it's very similar across all states of Australia. We're talking about control and domination and causing a person to feel fear over a prolonged period of time. So just to kind of, that's really the work of people to also to really go and understand that and make sure you understand what we're talking about when we talk about family violence and the ways that you might see it come up in the lives of your clients.
Mm. And to flesh that out a bit more, I am going to speak to coercive control. So family violence isn't always physical. It is a pattern of behaviors that's used to dominate a family member, cause them to fear for their own or another person's safety or well-being, such as a child. It includes exposing a child to these behaviors, as well as the effects and impacts. So family violence presents across a spectrum of risk, ranging from subtle exploitation of power imbalances through to escalating patterns of abuse over time. So this may include not just, physical violence and assault, but also threats to do so. It includes humiliating and intimidating members of the family through this pattern of behavior. So coercive controlling behaviors, it's a pattern of domination and includes tactics to isolate, degrade, exploit, and control, as well as frighten to cause physical harm. So it's coercive control is helpful for us to view family violence as the pattern of behaviors that it is, rather than separate incidents, as an incident-based lens results in the justice and service system missing the full reality of victim survivors' experiences and the extent of serious risk, because we do know that coercive controlling behavior is a very serious high-risk behavior. So examples of controlling behaviors can include the perpetrator telling the victim how to dress, who they can socialize with, how they can use substances, such as injecting practices, what services they can access, such as AOD treatment. It can be controlling supply of medication or other drugs, limiting cultural and community connection or access to culturally appropriate services, preventing work or study, controlling access to money or other financial abuse, determining when they can see friends and family or use the car. There's obviously a number of ways that this can play out. So due to COVID-19 social isolation measures, perpetrators are obviously likely to be spending more time in the home with victim survivors and exert increased controlling behavior. We know that the severity of family violence has increased during this time, and we know that it's been really difficult for victim survivors to try to seek help during this time because they haven't had a chance to have time away from the perpetrator. So recently, No to Violence held a members meeting with practitioners who provide services to men who use family violence, and they spoke about coercive control, what it looks like and how they see it in their work. And practitioners shared that coercive control presents quite subtly. Many men who come to that space automatically assume that violence is from anger, but practitioners really aim to have discussions about how family violence is present, how those behaviors are present without anger. Practitioners see patterns of coercive controlling behavior as much more insidious and difficult to prove, which can be an additional barrier for men taking responsibility for their violence. Coercive control can be more dangerous in some ways as it wears down the victim survivor's sense of self and autonomy. It undermines their physical and psychological integrity due to the perpetrator's use of ongoing various means to exploit, intimidate, dominate, humiliate, and control for their own privilege. So identifying family violence. So some things that you can look out for is negative comments about a partner or whoever the affected family member may be about their decisions, actions, viewpoints. So because we can all identify what a negative comment is, I won't jump into specific examples there, but the most important key here is thinking about the impact of the negative comment. So once you're actively listening with a family violence lens, the impact of these comments will become easier to spot and understand. So if we return back even just to the definition of coercive controlling behavior, the impact is to isolate, degrade, exploit, and control, and frighten. So when you're thinking about and when you're hearing negative comments about the victim survivor, which can be about anything, seemingly big or little, some of the considerations that you're going to have is, what is the impact of this negative comment? Is it to control specific behaviors of hers, such as seeking AOD treatment? Is it to isolate her from others and resources, such as leaving the house during COVID-19? Is it to degrade and humiliate? The Monash study that came out recently highlighted that perpetrators have been forcing victim survivors to cleanse their hands and bodies a lot during COVID-19 to the point of actual pain. So that's certainly obviously degrading and humiliating and painful. Is the intent to delegitimize her viewpoint or experience? If so, these are coercive controlling behaviors. So talking about a partner showing no respect, is he talking about not receiving respect or thanks for what he does? Narratives that center around him not receiving respect or thanks indicate controlling behaviors around enforcing rigid ideas of gender roles. So this can then translate to him punishing her or the children for not adhering to his ideas of these gender roles. So an example of this could be around division of labor in the home. Does he criticize her parenting? And is he doing this in front of the children, particularly during COVID-19? He could be using the virus as an excuse to not adhere to parenting orders by returning children. For example, if she's an essential worker, he may claim that she is putting the children at risk by being around them and continuing to go to work. Does he have a demeaning attitude toward women? Consider how this might pair with a concept of rigid gender roles. For example, if he sees himself as a provider and that she needs him to do things for her, is he speaking about her in a way that indicates that he dominates decision-making? And then blame circumstances such as stress or substance use for his use of violence, especially during COVID. He may blame stress, use of alcohol, losing employment for his use of violence, but there is no excuse for the use of violence. So before you respond, when you have identified, okay, I suspect he's using family violence, or, I've identified that he is, really asking yourself, what is the impact of what you're hearing, the narrative that you're hearing, and is he inviting you to collude? So before we get into collusion, I do want to distinguish stress from power and control, because this is certainly a question that's asked a lot. So everybody experiences stress. Everybody experiences anger. Not everybody responds by using violent controlling behaviors. So emotions such as stress and anger they're experienced internally. The use of power and control is a pattern of behavior that targets and harms specific family members. So this is why anger management is not an appropriate support for men who are using family violence. So anger management focuses on emotion regulation, and it's useful for individuals who experience intense anger and emotional reactivity in a wide variety of settings, such as with work colleagues, friends, in the community, what have you. Men's behavior change is it's the work that directly addresses his use of family violence and the underpinnings of it as well. And as we noted, as the practitioners noted in the NTV member forum, it's really important to highlight that family violence and violent behaviors, controlling behaviors, they're present without the experience of anger. So it really unpacks a lot more of what's going on for him as well in his use of these behaviors. And it recognizes that the sole issue simply is not emotion dysregulation. So what is collusion? Essentially, it means that he believes he did nothing wrong, and he's asking you to agree with his rationale for why he used violent controlling behaviors. Now, he may be asking you to agree with him subtly or explicitly, but invitations to collude will look different across each service and setting. So, for example, during COVID-19, a client may report drinking more than usual at night. Let's say he reported that he yelled at the kids while standing over them, trying to get them to be quiet. The stress of homeschooling boiled over. While it would be really easy to empathize and validate that behavior due to the stress, that's colluding with his excuse for using intimidating behavior and verbal abuse toward his children. So here's what I might say instead. It sounds like you've been drinking more to cope with your stress of parenting responsibilities during social isolation. How do you think your children have been experiencing you during this time? So collusion is really complex. You have to actively work to avoid colluding. But essentially what happens when you do collude is he misses an opportunity to take responsibility for his use of violence. So it's really important to hold yourself responsible and accountable by engaging in critical reflection and identifying new ways to respond to invitations to collude. So here's a bit of a framework to help you identify what invitations to collude might look like. And of course, examples overlap among these, but he might minimize it. He might say, nothing got physical, I just snapped. He might deny it altogether. She overreacted, nothing happened, all couples argue. He might blame her. She pushed my buttons. She knows I just lost my job. He could try and justify it and really sort of play on your emotions there as well by saying she cheated on me. He might say it's just the drugs, or he might pathologize her. He might say she's bipolar, she's just crazy, she was drunk. These are all invitations to collude because it's essentially him saying that he did nothing wrong and he's asking you to agree with that. So responding. Create a safe space to check in with the family. Now, if this is a feasible part of your service offering, are you able to check in with family members in privacy? If so, consider how your service can do risk assessments on an ongoing basis, as we know that risk changes over time. And of course, never tell the perpetrator anything the victim survivor disclosed, as this will likely increase risk. So if you don't have contact with family members, keep in mind that him attending a face-to-face appointment provides crucial time for victim survivors to be away from his violence, take care of themselves, seek help, what have you. This is especially true in the COVID-19 social isolation context, where victim survivors have not had the space and time to be able to reach out for help. If your engagement is on the phone, ask if he's alone, if he has privacy to talk. You don't want to engage in a conversation around family violence if he is around the victim survivors, particularly if he's minding a child. So if he is in the home with victim survivors, ask if he can find a private place to talk, such as going for a walk. You may ask where he is, what he plans to do after the call. If he's driving, ask him to pull over for the conversation in the interest of safety. These questions can all be framed in a privacy self-care lens, which they are as well, but they also help you to assess risk to victim survivors based on your engagement with that individual, such as if the conversation escalates, and it can help to safety plan some self-care strategies with him. You may encourage him to do an activity that relaxes him after the call, such as exercising, whatever that may be, making it individualized to him. But certainly it's something to think about, particularly if you are talking about family violence. So you're going to want to keep him engaged. Keep him engaged in the conversation, keep him engaged in your service, because the more he engages with your service, the more you have face-to-face contact or phone contact, the better able you are to assess risk and the more likely he is to be supported to seek help for his use of family violence. So you're never going to engage in an accusational, oppositional, or challenging manner, such as judging, telling him he's violent, arguing with him. All of that can increase risk. So if he is escalating, never match the escalation. And I'm sure that you have your own, policies internally around this. But escalations can look like him raising his voice, interrupting you, speaking quickly, having suspicions of the practitioner, like whose side are you on, or calling you names. So the first thing is to really focus on de-escalating quickly. And you can even do some here and now work if appropriate, such as even just taking a step back and be like, hey, I noticed that you're speaking a bit more quick now and you seem to be getting quite a bit upset and escalating. Let's take a step back. I want to make sure that this is an okay place for you to talk and that you're going to get something out of this service. So let's just take a step back. What's going on for you? Something tells me that this conversation is really difficult for you. Something of that nature. And as always, if you have immediate safety concerns, call 000 because that will initiate a response. So do not directly challenge the behavior, particularly in a confrontational manner. As an AOD worker, you are not expected to be a specialist family violence worker. You do not have to directly challenge behaviors. This can increase risk to victim survivors when he leaves your service, and if he disengages from your service altogether, we really lose an opportunity to assess risk, provide the victim survivors some safer space, and invite him to take responsibility for his use of violence. So instead of directly challenging, you're going to ask questions to assess risk. Use a very curious, invitational approach to open the conversation. If he says that they've been arguing a lot lately, ask, okay, what does arguing look like for you? Or if he's, describing that there's been some use of family violence, you can ask, what would I have seen if I were there, to try and flesh out what's going on and encourage some perspective taken on his behalf. So you're going to want to recognize and avoid invitations to collude. As discussed earlier, collusion happens when he believes he did nothing wrong and he's asking you to subtly or explicitly agree with his rationale for why he uses violent controlling behavior. So be invitational instead. Ask what he thinks of his behavior or the situation. Do it in a very curious, non-confrontational manner. This encourages his own self-reflection and it leaves space for him to take responsibility. And there might be a lot of shame wrapped up in that topic, in that conversation. So it leaves quite a bit of space for that as well. So you can ask something like, what do you think about how you acted then? Contextualize the situation to him. Do not rely on a shared understanding of common words such as arguing, fighting, whatnot. That actually leaves space for him to hide his use of family violence. So again, you're going to ask, what does arguing mean to you? What do you do when you feel frustrated? And then, of course, if you think you can do so safely, and this will be a bit more based on where you're at in the service setting, do you have an ongoing relationship with him? Encourage empathy for his partners and kids. What do you think that was like for, you name the victim survivor, when you took the car keys so she could not leave? And where appropriate and safe, offer change and support. So ask if he'd like to get some help to support the changes he wants to make and provide a referral, such as to the men's referral service. At MRS, we can discuss the use of family violence. We can unpack it, and we can identify appropriate local services for him to address that. So some practical things you can do now. Really think about how you either subtly or explicitly collude. And we all will collude at some point in time to some degree. So just recognize that that is going to happen. It's already happened. Let's just think about where we've done it and how we can do it differently next time. So a couple of things that you can do initially is really think about what words and phrases that you use to communicate that you're listening to someone that might also communicate that you agree with him. So are you saying, yeah, correct, right, as he's talking? Because that could communicate that you're agreeing with his narrative. And instead consider how you might use some, more neutral words and phrases to communicate that you're listening. So even instead of just try something like that. Or instead of right, correct, try I'm listening, go on, something like that. So really just being aware of the subtle ways, implicit ways that you might be colluding. And one of those things could be also, are you calling him mate? Avoid doing that because that's really going to show that you're on his side. That's you don't want to be approaching this from a I'm on your side or I'm not on your side type of stance. It's really going to complicate things and be quite confusing to him, and it's not going to invite him to take responsibility. So if he mentions his ex-partner, kids, other affected family members, always ask for their names and continue to refer to them by name. If he says, oh, my missus, you're not going to want to say your Mrs. Later on. So using their names humanizes them, and it encourages respect and empathy. When reflecting and summarizing, be mindful to really center his feelings and behaviors in your responses. So this creates space for him to be the agent of change. If he's saying, oh, she was pushing my buttons, you're going to respond, you felt frustrated. So think of subtle ways that you can really shift that conversation to what's going on for him, for his feelings, for his behaviors, for his actions. And that's going to create space for him to really change those violent behaviors. So I just want to add a few things in light of COVID-19. So these are some supports, I suppose. So always for serious and immediate risk, call 000. That initiates an immediate response. Even if you hold limited information, if you have immediate concerns, call 000. So for sharing risk-relevant information, call your local police. For during COVID, the police have Operation Ribbon, which is just family violence investigation units. They're actively initiating contact for high-risk perpetrators and affected family members, and in-person contact is prioritized where feasible and safe. So, for example, if a client discloses to you that they have breached conditions on an intervention order, or a new, they're describing a family violence incident that's occurred, this is all risk-relevant information to share with police. The men's referral service is an open line and web chat service. We've always offered single sessions, but right now we're offering multiple sessions where appropriate, and then of course you can call for a secondary consultation as well. So something for you to take away with your team, because it is going to take a bit of work to identify what invitations to collude look like in your service setting, like what are you most likely to encounter. So get your team together and ask these 4 questions. You can draw upon practice experience or case studies. You can ask, what do invitations to collude look like in our service? When have I colluded in the past? How could I respond differently? And what would be a good outcome for our service? Think about if you're able to share or request risk-relevant information, opportunities for strengthened referral pathways, or secondary consultations. Are you engaged with your local perpetrator intervention services? Can you call the men's referral service? What does that look like for you? And you can certainly, engage your local AOD, Specialist Family Violence Advisor, to flesh this out a bit more as well. So here's just a little banner on calling the men's referral service, particularly during COVID. The number is on the bottom right there. And you can also go to the No to Violence website for COVID-19 updates and a bit of information and resources. But we're certainly open, and we're, able to help clients, and we're able to help professionals who want some more information on how to engage and work with clients who are using violence.
Great. Thank you so much. So I wanted to just quickly go to a couple of questions here.
Yeah.
But the first person who's kind of come through on a question here is saying, when you're working with perpetrators, will the perpetrator's partner or family member be receiving support at the same time? I would like to know that they are safe. And that's really what we're really all working towards. But I suppose it's maybe a good point to mention information sharing.
Absolutely. Even. But also if he's engaged in a men's behavior change program or a case management model that's in that perpetrator intervention service, we have family safety contact workers in those services. So there are people who are contacting and engaging with the affected family members, the victim survivors, to assess what's happening, what their experience of his violent behavior is. Of course, is the family violence increasing, decreasing, what that looks like and what support they need, and really making sure they're linking them up with whatever they need. So if you do refer him to a men's behavior change program or something like that, just knowing that family safety contact work is critical to our work in that space. And that's actually why it's really important for him to be in men's behavior change as opposed to anger management or something else, because other services don't have that family safety contact work. It's really important.
That's true. Yeah. Did you want to mention anything about information sharing as
well?
Oh,
yeah, of course.
Because I think that could speak to that as well.
And if you're an ISE, so an information sharing entity, then you can actively request or share information with other ISEs. So really think about what other services he's engaged with that you could share information with, whether that's mental health, or if he is engaged in a men's behavior change group or something like that, or you can share information with police. So there's a whole wide variety of services that you can share risk-relevant information with. And that really helps us all to know what's going on, because risk changes so much over time. It's always fluctuating, so it's really important to continue conversations around that and constantly be assessing it and sharing that so everyone has a clear picture so they can provide the support that is needed.
What's an example of somewhere where would you say the police are somewhere that you might share information with if you were hearing in the scenario with your client that there was a high level of risk to the partner and children, as an example?
Yeah, of course. So if there's a high level of risk, you do have your mandatory reporting as well, and that's that's been there for a while. So you can also make a report to child protection and things like that. You can call the police and ask them to do a welfare check on the victim survivors. And of course, if you're concerned about his risk of suicidality, or if he's going to use family violence, or if you're fearful of risk of harm to victim survivors, definitely call police and have them go and check, particularly with Operation Ribbon. So they're checking on high-risk individuals and families, and if you're actively sharing risk-relevant information, that could really inform their response to making sure that those families get the support that they need during COVID.
And I think sometimes there becomes confusion because people believe that they are meant to share, that they're about to, contact or share that information with the person who's using violence, because they believe that under the Privacy Act. But, But actually for information sharing, this is new legislation. So under the information, that we're able to now share, or we're required to now share when it pertains to risk. So that's probably good to clarify as well.
Absolutely. And I think that you should be having conversations within your service, because I think in a lot of cases it's not appropriate to be telling him that you are sharing that risk-relevant information. That could increase risk as well. So just being really mindful of that. And if you have a client who's told you that he's breached a condition on his intervention order or something like that, you can certainly have a conversation with him and encourage him to report that breach to police himself. So that's something that you can do, but certainly it wouldn't be appropriate, and definitely not appropriate to be telling him that you're sharing that risk-relevant information, because that can increase risk to victim survivors.
Yeah. We've got a few more questions, but what I might do first of all is go to the questions from the people who enter their questions at registration point. So we did have a fair few questions that people entered at registration. So I just want to say thank you so much for participating in that. So we'll go through some of these now, and I think some of them may answer some of the ones coming through live, but we'll come back to those. So the first question we had was, considering the safety of children within our conversations with our clients who use violence. Could you say something about that?
Yeah, of course. So I think it's really important that whatever man you're working with in the AOD setting, really making sure that you're asking if he has kids and fleshing out what his parenting responsibilities are and what that looks like. So particularly for someone who uses family violence, or you suspect of using family violence, asking if he has kids, what are their names, and using their names when you're talking about them, what are their ages, what is the living situation arrangement, are there parenting orders in place, what his responsibilities are, what that relationship's like, and continuing to check in on that and making sure that you're sharing relevant information, risk-relevant information where appropriate, to support that child's safety. So whether that means a child protection report or what have you. That's really important, but certainly checking in and having conversations about the child, and what their relationship's like, and just making sure that you really understand the picture there. Are there parenting orders? I know during COVID-19, a lot of men have been not adhering to parenting orders, so, checking in on that and seeing, what's it been like? Have there been any changes to parenting orders lately or anything like that? You can get a bit of a picture as to what's going on.
Beautiful, thank you. The next question that came from one of the registrants was about stemming substance-induced violence. Does that make sense?
Yeah, so I really want to highlight that for someone who uses family violence, it's present even when they're not on substances as well, though it may look different, of course, because the use of family violence can certainly increase if someone's using substances when they're on substances. But basically, if someone's aware that they're using family violence, they need to be safety planning around their use of violence, and around the risk that they present. If they know that they use physical violence when they are drinking or what have you, then they really need to be doing that away from the victim survivor. And most intervention orders will have a clause around not using substances. So that's really important to know and to be asking about as well if he has something like that. But certainly encourage help seeking for the use of substances and the family violence. Again, the use of a substance is not an excuse for the use of family violence. Family violence is a pattern of behaviors. So it's really important to try and flesh out what's going on when he's not on substances as well.
And I think also with alcohol and other drug clinicians, there's always a harm reduction lens. So including that in your harm reduction, the ways that you speak about harm reduction. So if you can hear within the story the escalation as well of use of violence or controlling behaviours, I suppose you'd want to include that as well. So just reflecting that back to the person. Like I can hear that when when you're drinking over a certain level, then, this is when it escalates, when you've told me you start yelling at the kids and things like that. So reflecting that back and making a safety plan with the person around that as well. And the same way you might share with them harm reduction strategies and meet them there and negotiate that, you'll do that in the same way if that's possible in the dynamic.
Yeah, because they are responsible for the risk that they present to others.
Yeah. The next question is, what are some helpful tips in your practice in calling out, so this person's used that language, calling out the client about their abusive behaviour? How do you go about instilling ideas of change to stop the client from repeating the same abusive behaviour?
So I certainly understand where this question is coming from, and that when you recognize that family violence is present, you're using that family violence lens. I understand the urge to want to call out these behaviors, but it's really important that in the AOD service setting, you're not directly challenging these behaviors, particularly during COVID-19. So, during the initial social isolation measures, No to Violence advised men's behavior change practitioners who were no longer able to meet in groups to really be focusing on safety and, making sure that you're focusing on safety rather than active change work, because that's really challenging anyway. But again, just jumping back, we're not calling out behaviors. We really want to make sure that we're not engaging in an oppositional, confrontational way, because that can really, he might not engage again, and he might not share, risk-relevant information with you again. He might not have those conversations. So we want to engage in an invitational manner, very curious, ask questions, flesh out the situation, ask him what he thinks of it, and that will really inform, and then use the processes that you have, that your organization has, to manage that risk. Are you providing him a referral? Are you using information sharing schemes? Are you engaging in secondary consultations? There's a lot that you can do behind the scenes that really support this work as well. And the more that you use a curious invitational approach, the more likely he is to take responsibility for his behaviors, because that's what you're inviting him to do. And that is more likely to lead to actual change. Yeah.
This next question, we might have to interpret it a little bit. How would someone unlearn a violent response if that's all they have known people to react with under stress? So I suppose this question is asking about whether they believe that family violence is something that's a learnt behaviour. I'm not sure. What's your thoughts?
Look, there's a lot of people who experience family violence who do not go on to use family violence. This also indicates to me a possible history of trauma. which tells me that the individual is also aware of the pain inflicted by their own actions and the harm caused and the impacts of that. So, finding new ways to respond would really help their own healing as well. And certainly we don't want to assume that because someone's experienced family violence or they've experienced other traumas as well, that they don't have the ability to change their own use of family violence, because that just doesn't give them any space to change. It doesn't invite them to. It's not expecting anything different. So what we want to do is make sure that we're not using trauma as an excuse for the use of family violence. We want to create space for them to really be able to look at their own behaviors and invite them to use more safe, equitable patterns of behaviors. And I think that would support their own healing as well. So certainly if you have someone who's using family violence and they have a history of trauma, inviting them to get help for both of those things as well.
It's because not an either or. Yeah.
No, we know that trauma really requires, say sensory motor approaches and things like that are different than just regular talk therapy. So we want to make sure that we're setting that individual up with and getting them linked up with the supports that they need. Yeah.
I might just switch over to one of the live questions. Could you provide some tips for safety planning with the victim when you're about to speak with the father about his controlling and violent behaviour? So just some tips around. So it sounds like this is, and you did mention earlier, like when we know some services have contact with all of the family.
Yeah.
So maybe this might be somebody saying they have that contact with the victim survivor as well, and they want to broach the topic of the controlling behaviour with the father and the family.
And look, I don't want to, because we have the MARAM victim survivor practice guides out, I really just want to refer you back to that for this question, to be honest, because they do lay out safety planning and all kinds, what you need to be able to work in that space. And I don't want to overstep anything at all, of course. I encourage you to look at the victim survivor practice guides and really look at the recommendations there for safety planning. Family Safety Victoria has also put on online some COVID-19 MARAM practice notes for general practitioners. They've also put one up for working with victim survivors, for working with perpetrators, around adolescent family violence as well. So there's some tips and resources that are specific to the COVID-19 context. So I'm really just going to refer you on to that because I think that those are really great established resources.
Yeah. Yeah, so there's for safety planning with victim survivors, there is a resource that is online. Just because I'm aware we've got a lot of people who aren't also in Victoria, just MARAM is the Multi-Agency Risk Assessment and Management. I always have to think about it. But we'll hear a lot of MARAM, but it's for those people who are not in Victoria, it is the response, the Victorian government's response to the recommendations from the Royal Commission. It is an extension of, and I know the CRAF, the Common Risk Assessment Framework, was very common around the whole country, so many people working with the issue of family violence would have known what CRAF is. So it's an extension on CRAF, including more evidence base for people to be able to work with to identify and respond to risk. So it's still a risk assessing framework and a response to risk in family violence, and that's the Victorian government's response. Yeah. So I might jump back over here. Questions everywhere. So I might just join these two questions together. We had somebody asking about economic abuse and family violence, wanting to know more about that, and also somebody saying, could you also talk about the intersection between family violence and gambling?
Yeah, of course.
I know we have a resource.
So I've added, I think we've put a couple of resources up.
Yeah, they're in the resource folder. You can download that now.
So there's 2 practice notes in there. So during COVID-19, No to Violence has been holding member updates a couple times a week and coming up with a practice note that's been released. So some topics that we've talked about are economic abuse and gambling as well. So we attach 2 resources that have some information around what that looks like for men who are using family violence, as well as some available support. So for economic abuse, really noting that there's quite a few banks such as Commonwealth and ANZ who have support options for victim survivors who are experiencing financial abuse. And then for gambling as well, I think it's really important to highlight, really consider the impact if he's also gambling to a significant, degree, and how that impacts his use of family violence as well, and the patterns around that. And also that during COVID, he's no longer leaving to do that. He could be doing it online, in the home all the time, and the impact that that's going to have on victim survivors, not being able to be away from him, or even if the victim survivors use gambling as a way to be out of the home themselves, that sort of safe haven no longer is there. So there's a couple of supports as well around gambling, and if you're working with a client who's identified that gambling is an issue for him, and the way that it interplays with his use of family violence as well, he can self-exclude from gambling websites. So there are things out there that he can do, and certainly there's supports out there. So have a look at those 2 practice notes, that'll flesh it out a bit more and provide some specific supports.
And there might be a few topics here too, I might just jump in, that maybe that's a topic people want more information about, that we could even go deeper on if we have enough interest, then we could create a webinar about that.
Yeah,
we've got another question here from a registrant. Are there differences in how we work with people who use violence if they are from the LGBTIQ community?
Yeah, so we know that intimate partner violence occurs at the same rate within lesbian, gay, and queer relationships as it does for cisgender heterosexual women. And we know that family violence rates are higher for bisexual, trans, and gender diverse individuals. So when I say that, really think about how the term family violence is much more inclusive of different types of violence. So if you're thinking about, say, a young person that comes out about their sexuality or gender, and how their parents and other family members respond to them and harm them and use family violence toward them. So that's definitely a consideration, because we know that happens a lot. So that is a form of family violence as well. So there's not enough perpetrator intervention services for the LGBTIQ community. We know that in Victoria, Thorn Harbour Health offers a men's behavior change group, and Berry Street offers a group for women who use force within their relationships. With Respect is a resource for the community and professionals, and then we also have Switchboard and Q Life as well. But really what we know is that our understanding of family violence really historically comes from a dominant understanding of what that looks like in cisgender heterosexual relationships. So there is a lot more to flesh out there, and other considerations such as is someone using outing someone as a threat, like in other communities in their life, if they've not come out to their family members, as a partner,
or to their
workplace, or a workplace,
or maybe their faith.
Yeah, absolutely. Yeah. So there's certainly additional considerations there, and things that you need to be able to identify and support people around.
And I do think it's why it's also really important to really understand the legislation, have a really good foundational knowledge and understanding of what family violence is. Once you hear power and control and you have an understanding, you have that lens, you can't unsee that. You will see that in the lives of your clients. So, and having an intersectional lens, so understanding where somebody maybe experiences oppression or discrimination in the community, just in their life in general, and then listen for how that might be being used against them as well. So that's why we really look at intersectionality and having an intersectional lens as well. It helps us understand the lived experiences of our clients, and especially when it comes to assessing if there's risk for that client as well, like where could that be used against them.
Absolutely.
Yeah. And also you've picked up too about, I did have somebody ask about tips for working with women who use force. And so you've mentioned also Berry Street.
Yeah,
runs a program.
So Berry Street has the Positive Shift program, and to be honest, there's a microphone there. My experience is in working with men, so I want to leave space for that, and maybe that's an opportunity for a different webinar.
Yeah. If that's something that you're finding in your practice and you want more information, please give us that feedback as well, so we know that there's a real need for that, and we can search out somebody to do a webinar for that as well.
I do want to note, because I didn't mention earlier around collusion, an invitation to collude might look like men presenting themselves as victims of family violence when really they are the perpetrator, and we know that we see that quite a bit as well. So definitely being aware of that and using the, family violence is about power and control, and it's patterned behavior, and really staying connected to that and thinking about what it's like in the larger context.
And if there was the ability, I think the data really tells us there is a difference between the ways that men and women experience family violence. One of those things being if the person was to leave or try and leave, would they be pursued? Would the violence increase? Would their risk escalate or increase with them leaving? And that seems to be a big difference. And that can sometimes be a question, like talking about whether you thought about leaving this relationship, and hearing if there's risk in leaving can sometimes show you who is actually the person at most risk in the dynamic as well. We're getting close to time. It's really gone quickly today. So I'm just going to quickly get through a few of these. So how do I tread that line between engagement and challenging behaviours during COVID?
Look, if it's in line with your role, plan for continued engagement, and if possible, have face-to-face meetings with men who use family violence, because that is going to provide space for victim survivors to reach out for help or just have space away from them. Don't directly challenge behaviors. So really we're looking at non-collusive engagement, and that's the best we can do, is be curious, be invitational, and then use your organizational supports and what you have. You have information sharing schemes in Victoria. You can refer, you can provide secondary consultation. So really focusing on what does non-collusive practice look like for me.
Great. And then the next question I might jump to is, I'm assuming the person is a counsellor. Somebody is talking about approaches to counselling. So I'm assuming that the person is asking, like, if they identify that there's somebody is using violence and they are a counsellor. We'll go with that.
So look, whatever your service setting or approach, you can practice non-collusive engagement with people who use family violence, and just think about family violence risk and your responsibility to be identifying and responding to that, and put it in the same context as you would be working and asking questions around suicide risk, and you're trained to identify that and to be able to respond to it, and think about family violence risk in that lens as well. So we all have a responsibility to use non-collusive practice. You're not being asked to be a specialist family violence service or intervention. You don't have to directly challenge. You don't have to change them. But use a curious invitational approach and avoid collusion as best you can.
The next question, we've got a question that looks similar to one of the ones from the registration, so I might put them together a little bit. Is there any specific research or evidence-based interventional prevention around family violence when the perpetrator is the son or daughter towards the parent, and maybe they're under the age of 18? And we have got somebody who's in far north Queensland who's seeing an emerging trend of young men between 15 and 18 at the moment who are becoming aggressive with caregivers, usually mothers. So just they're asking for any hints, reworking with young men in these kind of situations.
Yeah, absolutely. Look, this is still a very new space, and there's a lot of developments happening, but we don't have all the resources and information that we need at this time, to be honest. So what you can do and what you can look at, though, is the PIPA Project's report. So that's Positive Interventions for Perpetrators of Adolescent Family Violence in the Home. That was a study that looked at legal responses to adolescent family violence, and that report can be found on the Anne Rose website. And Family Safety Victoria also released a COVID-19 Mayor in Practice note around adolescent family violence as well. So I'd go to their website and have a look at that resource during this time. But, it is, just to be frank, it is still a developing space, and we need a lot more resources and interventions and supports. All
right, we're just on time. We might see if we can slip one more in. once we recognize that once we identify family violence, what is the next step? So what services are available and what is our legal obligation?
So anywhere you are in Australia, you're at least going to have mandatory reporting obligations. So I just want to get that out there. If you're in Victoria and your organization is prescribed under MARAM, they have a responsibility to align to MARAM, which is the Family Violence Multi-Agency Risk Assessment and Management Framework. Your responsibility as a practitioner is to really be able to identify and respond. So just use non-collusive practice, become familiar with the risk factors. So you can look at the, Family Violence, not handbook, the Foundation Knowledge Guide. That's on the website as well under MARAM Practice Guides. The Victim Survivor Guide is there as well. So become familiar with that. And, this is still a developing space, and we're in the middle of, implementing these reforms as well.
During a pandemic.
Yes.
Yeah. We are going to wrap up, and I've got several people asking me, can they have the replay of this? The answer is yes, this is being recorded. You will be sent the replay. If you don't get an email with the link to the replay, because sometimes that happens, you will just go to the turningpoint.org.au website, and all replays of all webinars are on there, so you can absolutely grab that and share it as well. And also the slides from today. I've got several people asking if the slides from today are available. They're in the resource folder, so if you have a look in there, you should see a copy of that. If it's not there for any reason, please email. You can call Turning Point as well. So just call the head office at Richmond. So just to get that out there. But just before we do start to wrap up, somebody's asked about some tips about safety planning when people are in the home together. And I think there's a couple of people that are asking this here too. Do you want to add any tips before we kind of wrap up about safety planning?
Yeah, of course. So look, if you're working with someone who uses family violence, I think obviously it depends on what your role is, what your, relationship and engagement with that client is like. But if you've identified what the risk that he presents is, how can you safety plan around that? So it's going to be individualized. But if you're looking like if he's using a substance and knows that he uses, say, physical violence when he's used that substance, and making sure that he's not ever in the home or not going to return to the home when he's using that substance, and looking at other self-care strategies that you can use, such as, making sure that he's going for a walk, providing a referral to the men's referral service where they can flesh this out and do a lot of that work as well. And you can even call the men's referral service too, to be able to have those conversations and whatnot. I guess it is hard to say because it is individualized, but really thinking about what is the specific risk that we're talking about here, and how can we create a plan to avoid that. So, does that mean him being out of the house? What exactly does that mean for that individual and that risk factor? I know that that's a bit of an unsatisfactory answer, but I really recommend, frankly, taking it back to your teams and unpacking this, and also connecting with your local AOD specialist family violence advisor to unpack this as well and make sure that there's more strategies and things in place around that.
Yeah. But many of the things that you've already covered, I think, do fit within this safety planning, like the approach. So making sure that, first of all, that that he's not with other people, and especially children, but also if you can hear that there's escalation, then talk about you did frame it in self-care and being able to care for self. So things like, look, what are you going to do after this call? Could you go for a walk?
How does he de-escalate himself? What strategies does he have around, how can he recognize when he's escalating, and how can he then take responsibility to de-escalate that and be aware of his actions? Does he tend to stand very close to people when he's angry? Definitely putting space in between them, because that's really intimidating and scary, obviously. And, what can he do to recognize when that's happening? But then also around controlling behaviors as well, because remember, it's not always when anger is there, when those hot emotions are there. So again, really thinking about what that looks like for him and planning around that.
Yeah. And also telling people, like we do say, like we talk to everybody about this. We know, so if there isn't a level of awareness there, then just making sure that you talk in terms of like give the preamble, like we like to check in, make sure everybody knows how to care for themselves after the call, those kinds of things.
Absolutely, and really encouraging help-seeking behaviors. I think that's really the biggest thing that you can do is be non-collusive and encourage him to seek help for this. And, because that's inviting him to take responsibility and take action to not use those behaviors anymore. Because, again, you don't have to be a specialist family violence service. That's what's, really important here.
Yeah, and everyone's playing their part, especially right now.
Absolutely.
Yeah. Thank you so much, Claudia. I want to really just extend such, gratitude for you taking time out of your day to present this information. Thank you to everybody who stayed live with us. I know we've just gone over time, so thanks also to Redback for staying with us. And I really apologise, we didn't get through all the questions that were on that came through at registration. I've gone through the ones that I thought maybe stood out from the main content, so I do apologise. If you have feedback, if you have specific topics that you do feel you need covered for the work that you do, please do stay and put those into the feedback exit survey. Thank you again for spending time with us, and we look forward to seeing you at our next webinar. Thank you.